Hello, today I'm going to be giving an introduction to high altitude, specifically focusing on altitude sickness. By the end of this video you should be aware of the three main types of altitude sickness and their symptoms, treatments and causes. The world's tallest mountain, Mount Everest, is over 5 miles high, peaking at a huge 8,848 metres. And the first successful ascent was made by Tenzing Norgay and Edmund Hillary in 1953. Everest towers 6 times higher than the UK-sized mountain Ben Nevis. Climbing Everest remains a huge attraction, and recently new restrictions were introduced to minimise congestion amongst climbers. Despite more people embarking on Everest than ever, climbing the mountain remains extremely dangerous, with over 200 deaths recorded since records began, including 10 people in 2013. Many fatalities are caused by physical injury, but one of the main killers is altitude sickness. To understand how altitude sickness works, it's useful to understand the effect altitude has on the atmosphere. As shown by this graph, as altitude increases, atmospheric pressure decreases. This means the air molecules are spread further apart, which causes a decrease in what is known as the partial pressure of oxygen. Oxygen is essential for the maintenance of life, and with less oxygen in the atmosphere, we have to work harder to stay alive. Both rate of breathing and heart rate immediately increase to try and compensate. This graph just illustrates the decrease in oxygen levels as altitude increases. Now, moving on to altitude sickness. Altitude sickness is the umbrella term for all of the illnesses caused by high altitude. Symptoms can start to be observed at 2,500 metres, although not everyone is affected at this altitude. As altitude increases, the chances of developing altitude sickness increase. As Ben Nevis peaks at 1,344 metres, it's not possible to develop altitude sickness in the UK. Acute mountain sickness is an early, non-serious form of altitude sickness. Symptoms are quite generic and include headache, nausea, dizziness and insomnia. Because of this, acute mountain sickness can be likened to a cold or a hangover. Due to the common nature of the symptoms, many climbers ignore their illness and continue to ascend, which can be very dangerous. Fortunately, acute mountain sickness can be treated easily by descending to a lower altitude or simply resting for a few days to acclimatise. Acclimatisation is the process by which the body adapts to high altitude for a number of different mechanisms. This is the same technique many long-distance athletes use to improve their stamina. At 2,500 metres, around 15% of people are affected, whereas around 75% are affected at 5,000 metres. Acute mountain sickness is relatively harmless, but if individuals continue to ascend, then they may develop more serious conditions, such as high-altitude cerebral oedema. High-altitude cerebral oedema is a serious condition that can lead on from acute mountain sickness that is left untreated. Cerebral oedema is defined as unwanted buildup of fluid in the brain. Low oxygen levels cause leakage of fluid from the cells in the brain, which ultimately leads to rupture of the brain tissue. This image shows an MRI scan of a brain with cerebral oedema. The white part indicates the fluid buildup. Symptoms of high-altitude cerebral oedema are advanced versions of those associated with acute mountain sickness, but they also include ataxia, which is the loss of balance and coordination, hallucinations and loss of consciousness. If high-altitude cerebral oedema is allowed to develop without treatment, the patient can enter a coma and die within 24 hours. Patients must be brought to a lower altitude immediately and given anti-inflammatory drugs in an attempt to reduce leakage. High-altitude pulmonary edema is characterised by unwanted buildup of fluid in the lungs. This is the most dangerous form of altitude sickness, with only 50% of patients surviving. Symptoms include difficulty breathing and a blue skin tone, as well as advanced symptoms of acute mountain sickness. Low oxygen levels cause blood vessels in the lungs to constrict, resulting in a rise in blood pressure. This high pressure causes a leakage of fluid into the alveoli, which are the site of oxygen transfer in the lungs. This results in inadequate transfer of oxygen to the blood, leading to difficulty breathing. Supplementary oxygen must be given to pulmonary edema patients as soon as possible to improve survival chances. Like other forms of altitude sickness, patients should be taken to a lower altitude immediately. Drugs that lower blood pressure can also be used. These are known as vasodilators. To summarise, altitude sickness is caused by a decrease in oxygen levels, and all forms can be treated by moving to a lower altitude if possible. Climbers should rest regularly in order to acclimatise. Chances of developing altitude sickness are increased by the level of altitude and the rate of ascent. Thanks for listening.